Hi everyone, I'm Dr. Kirk Weber and I'm a chiropractor. And today I would like to spend a few minutes talking to you about 5 tips for you to utilize with low back pain when you're at home. As we all know, low back pain is one of probably the most debilitating and miserable conditions to deal with uh, in the United States today. There is more people who are losing time from work. There are more dollars spent on low back pain for disability than probably any other condition that we have out there. And I want you all to know that medicine and surgery are not always the answer. So today, as I said, I want to go through 5 tips that hopefully you can use and utilize to help you at home. And I'm going to start with a bonus tip first, because the 6th tip, the bonus tip, is please seek out the services of a chiropractor. There's more there than you may realize if you're not already a chiropractic patient. But the first of the tips that I want to give you is the use of ice. Now, I know there's people out there who are going to say, you know, Kirk, I use heat, heat feels good. Or there's others who are going to say, hey, I use heat and then I use ice and then I use heat and then I use ice. And contrasting is good, it has its place. Heat is good, it has its place. But I am a fan of ice, and I'm a fan of ice for 2 reasons. Number 1, simplicity. We don't have to remember any complicated rules. We just get the ice and we put it on. Second, ice will make the tissue go numb. And when you're hurting, numb is not a bad thing. So here's how I do it. Here's the secret that I give to my patients. Take a bag of frozen vegetables, something that no one likes, frozen okra. Mark it with some big X's on a black magic marker so that when we reuse it, you don't try to eat the stuff. Take the frozen okra, wrap it in a dish towel, and place it right back there on the small of the back where the discomfort and pain is starting from, and wait for about 10 minutes until that starts to go numb. When it goes numb, you pull the frozen vegetables out, you toss those back in the freezer and get ready for the next time you need it. I recommend usually 3 to 4 applications of ice a day to kind of help control that discomfort and pain. The second thing that I like to recommend to people is massage. Now, it would be great to be able to go out and get a massage therapist and go have a great massage with all the hot stones and the oils and the whole 9 yards, but that's not necessary. We can do this at home with, a friend or a family member. Even a young child can help you. And what we recommend is some light palm down on the skin rubbing, okay? And we usually like to try to rub as much of it towards the heart as we can, but you don't have to push hard. We don't have to remove layers of flesh. It's just a nice, what we call effleurage. It's just a nice movement across the skin. Now, this does a couple of things for us. Number 1, it moves fluids out of the area. There's a certain amount of circulation increase that happens as we do that. So that's going to flush away toxic waste, toxic materials, things that can irritate the area that's hurting. The second thing that it does is after a period of time, okay, you start to go numb. You don't sense it anymore. If I take my skin and I continue to rub it, after a period of time, I become unaware. My mind just kind of blocks it out. And I don't feel it moving after a period. That's why you're kind of unaware of the clothes that you're wearing. You don't feel them so much. The third tip. My third tip is to stretch. The body's reflex to an injury, especially in the spinal area, is to splint. Get those muscles to tighten up. And they want to tighten up so that you don't move, so that you don't irritate it. The problem with that is twofold. Number 1, it limits your motion. Number 2, the brain will start to develop a mindset. It will start to develop this this position that it holds, it takes, and it says, movement is going to hurt. Movement is going to cause me pain. And now you start to develop a fear. You don't want to move because you're afraid it's going to hurt. So one of the things that we want to do is we want to stretch those muscles, much like an athlete, stretching those muscles out, getting them to go a little bit further than what they normally do, and trigger that reflex to get those muscles to relax. Now, as we do that, we're also increasing some blood flow into the area. We're reducing some of the chemical waste that have been built up in the area, and that also works to get you some relief and some drop in the pain. Now, one of the big tricks that I use with my patients who have prolonged amounts of severe discomfort is, even as a chiropractor, I will turn to some analgesics over the counters. And rather than take big, high, heavy doses, what I do is I'll have them alternate their doses so that there is always an elevated level of one painkiller or another in the blood. So let's say that you're taking ibuprofen every 4 hours. So you take the ibuprofen at the 2-hour mark, the ibuprofen is peaking, and it's going to start to dip down in the amount that's available. At the 2-hour mark, take Tylenol. Okay, and as the ibuprofen is falling, the Tylenol is rising, so you constantly have that level of painkiller in your bloodstream. Now, always be absolutely certain with your doctor that you are capable of taking Tylenol and ibuprofen. Number 2, I'm not concerned with any deleterious side effects from taking these because you're not going to be taking them that long. We're doing this for 24 hours, 48 hours until you get through that acute stage. So the last tip that we have for you has to do with the brain-gut connection. Now, there is definitely a connection between the brain and the gut. As a matter of fact, research is showing now that the gut actually has its own kind of mini brain kind of capacity down there. And the signals are running from the gut to the brain to tell the brain what's going on. The brain returns the signals. Most of the signals, 80% of them, are traveling towards the brain. Only 20% are headed back down to the gut. So that tells you that there's a lot of things happening, a lot of feedback in there. Now, there are probably 1,000 or so different types of microbacteria that are in the gut. They are essential. They need to be there. There are some who don't need to be there, but the vast majority of them need to be there because it's their interaction with the nervous system in the gut that starts to do things like produce neurotransmitters and all these different things that are essential for us to have. So if the gut is involved, and if those neurotransmitters are knocked off balance for any reason, let's say that you've taken an antibiotic and you've wiped out all the flora, now you're going to have things happening that shouldn't be happening. You're going to have constipation. You're going to have a mood change. You're going to have, they've actually started to link the depletion of these bacteria to things like Alzheimer's and dementia, and they're finding that it causes musculoskeletal issues, and when this balance is thrown off, we have arthritic issues. So keeping this balance is super, super important. So what we recommend is that you do things to not throw that balance off by avoiding things like dairy, avoiding things like sugars or the bad carbohydrates that we all know we shouldn't be eating, the flours, the cookies, the cakes, etc. We're going to ask you to go ahead and increase your water intake so that we can flush things out of there. We're going to ask you not to take any antibiotics. We're also going to ask you to go ahead and take probiotics and prebiotics, and to go ahead and increase the amount of fiber that you're taking in with your body. What this is going to do is it's going to restore that natural balance between the gut and the brain. We're going to keep our mood good. We're going to do better with how things are working. We're going to actually start to make that dopamine drip start to work a little bit better, and you're going to hit a more pleasurable sense. Now, thinking of the dopamine drip, also in that gut reaction, okay, is going to be a big mood change that can take place if this thing is not taken care of and taken care of properly, which goes to show that the mood has to do with enhancing and decreasing the amount of discomfort and pain that you have. So my recommendation to you also would be to take some time and do some nice basic meditation. Just even if it's nothing more than sitting with your feet flat on the floor, your eyes closed, and just smooth, easy, relaxed breathing. Try to keep things a little bit more calm so that that stress doesn't stir up that gut reaction. So folks, there you go. Those are my 5 tips for you for low back problems. We have the ice, we have the massage, we have the alternating medications, we have the brain gut reaction, and there was 5. Ice, massage, stretches, there they are, we found them. So I hope that these serve you. I hope that they do well for you. I hope that there's something that you can utilize and put to use right away. As always, if you have persistent pain with this, if it continues to bother you, please seek the counsel of your doctor. Find a chiropractor, find your medical doctor. It doesn't matter at that point. We need to know what it is and take care of it. But regardless as to whether you're seeing a medical doctor or a chiropractor, these tips are going to be beneficial to you. They will help you. They will help speed the recovery process. They'll make things a lot easier and a lot nicer for you. So, if you find that this information is useful, please share it. Let others know so we can get this message out to folks. We're trying to help you live a little bit better life and live a little easier life. Okay, hey, thank you very much. Bye-bye.